Good, so much better. All right, so I'm a medical doctor. I'm a medically trained health professional. One of the first things they teach you as a doctor is you've got to respect your patient confidentiality, and I take that very seriously. So we're going to do this as an interactive workshop. There's not going to be a lot of slides here. Actually, in fact, there's not going to be any slides here. And because it's a workshop, I'm going to get you guys to do a lot of the work. So like I said, I take confidentiality very seriously. And so when I'm asked questions, when I ask you whatever the question is, I don't want you raising your hand or jumping out of your seat or anything. What I want you to do is respond with a loud hum. And we're just going to practice this, okay? So how many of you are having a great time at this meeting so far? That's a good hum. All right. How many of you guys are health professionals? How many of you are not health professionals? Well, that's about 1 to 1. Or are you guys just all humming at the same? No? Oh, let me try this one. How many of you are from Canada? Okay, I'm not. Well, because I'm from Germany, right? So, okay. How many of you have been to Canada? Everybody, yeah, good. All right, so that's how I want you to respond. So now here's where I'm going to ask you the serious question. And the serious question, no, actually, you know what? Before I get there, let's talk a little bit about the health professionals. So amongst the health professionals, how many doctors in the room? A couple of docs. Okay, good. Nurses, dietitians, psychologists. Sounds like we got the odd psychologist. Like not the odd psychologist, but the odd psychologist. Any pharmacists? Therapists, yeah. Okay, all right, well, we got a therapist. I'm not pointing. All right, great. So let's start with this. I mean, how many of you, and I'm including the health professionals, have lost weight before? Okay. How many of you put some of that weight back on? That sounds like more people put the weight back on. How does that work? Okay. How many of you know someone who's lost a lot of weight and is keeping it off? Let's say without surgery. Well, sounds like a lot of you know someone. Okay, and we know that these people exist, right? You were hearing this from Jim Hill in his presentation this morning. They run this thing in Denver, the National Weight Control Registry, which, when you come from Canada, you think it's kind of funny. Okay, the US has got a weight control registry. Yeah, you don't have a gun registry. But there's a lot of stuff you can learn there, because these people do exist. I mean, the people who lose weight and somehow manage to keep it off actually do exist, right? And we all know someone who's done this. And it is interesting when you look at how do these guys manage to do this. Well, you listen to Jim this morning. What do they do? What do the guys in the weight loss registry do to keep the weight off? Yeah, they eat less and move more, basically, right? ELMM. Has anybody ever heard that from their doctor? You know what? You just need to eat less and move more. Never heard about it? No? Okay. A lot of my patients have, we call that ELMM, ELM, right? Like Nightmare on Elm Street, right? It's about, for most people, and I'm not talking about the guys in the registry, I'm talking for most people, this is about as effective as telling someone with depression, you know what? You need to cheer up. You got panic attacks, don't worry, be happy. Right? That's sort of the approach, right? For some people, maybe it works. For most people, it does not. And when you look at what the guys in the weight control registry are doing, and you heard this, I'm sorry I missed the talk, but I've read some of the papers from the registry. What are these guys doing? They're not eating a lot. Well, what does the average guy on the weight loss registry eat? How much is that? What? 1,400, right? That's not even a happy meal. Right, that's all the calories for the whole day. That's not a lot of calories. On top of that, what else are they doing? Yeah, how much are they exercising?
An hour a day.
Pretty much an hour a day. How many calories are they burning in that exercise? 300 to 500, right? It's 2,800 calories a week. That's about 400 calories a day. 400 calories a day exercise. That's a lot of exercise. You ever been on one of those stationary bikes where they have the little calorie thingy that's, you know why they call them stationary bikes? because those numbers never change, right? They just stay the same, you know. And that's a lot of hard work, right? So these guys are eating 1,400 calories and they're exercising 400 calories, which means they're really living off 1,000 calories. Well, good luck with that. Well, that's hard to do. So these fellows have not only managed to climb to the top of Everest, they've actually set up shop there. And believe it, some of these guys will eventually come down. This is hard to do, right? And when you look at all of the data that's been done on this, and you crunch the numbers, you know, out of 20 guys who started diet and exercise program, how many of them are going to lose weight and keep it off? What do you think the numbers is? How many of you think it's maybe half of them, maybe 10 out of 20? You're not very optimistic. Okay, what about 5 out of 20? 2 out of 20? Well, it's actually 1 out of 20. You know, it's approximately 5%. You wait long enough, pretty much everybody puts the weight back on. But that's how hard this is. And it's not because they're not trying. In fact, a lot of these guys are not just trying once, they're trying it over and over again. When I got patients in my practice, they come in, you know, they're 300 pounds now. They probably lost 500 pounds over the course of their lifetime. Right? They're highly motivated. Of course they're doing it, and they keep doing it, and they keep trying, and they do it over and over and over again. And now they're here, and now they want to do it again. I said, why would you want to do this again? I mean, this hasn't worked in the past, and here you are, you want to try again. This is very hard to do. Now, why is this so hard to do? So here's my way of explaining this. I'm going to need one volunteer. I need somebody to come up, join me here on stage who would like to lose maybe a couple of pounds. We don't have a lot of time, so it's probably going to be a pound or two, but anybody want to come up? I need a volunteer. Come on. Well, give her a big round of applause. Here, there we go. All right, who are you?
Angela.
Angela, all right. So Angela is a very brave person. She wants to lose some weight. So we're just going to do a little experiment here. I'm going to put it on the microphone and hope the other one is still working. What I have here is a gastric band. We took this out of a patient a couple of days ago.
Oh boy.
But it's all clean. Don't worry, I won't tie you up. So just watch carefully. Here's what I want you to do. You know, you wrap one end around this one hand and the other, so just so you can give it a good pull, right?
Okay.
All right. So you do this. Have you done this before? She might have, huh? She looks like she's in the know. Okay. All right, and now I want you to just hold it up and down. Okay, so great. So this is Angela. This is Angela's weight right now. And we're going to help Angela lose some weight. So you guys are all experts. What do you think Angela could do to try get some weight off? Like, where would she start? What have we got for her? Like, just throw stuff at her that you hear from your doctor. Some of that good advice. Okay, one at a time. Eat less. Okay. So you want to start a diet? And maybe that's starting to work. So seems to be working. What else can she do? Start moving. Okay, all right. She's already getting skinny here. Anything else she could possibly be doing? Take some drugs. Put her some medications. Whoa. As she keeps this up, she's going to disappear on me. What else? Okay, well, she's doing great. Okay? Are you happy with that weight?
Keep it up.
Okay.
Sure.
So now comes the easy answer. Now, what does she have to do to stay skinny?
Keep going.
Yeah, just keep pulling, right? Just keep pulling. It's that easy. And she's doing a great job, I can tell you. You know, we can all wait here and see how, how long do we give her before she relapses? What do you think? She's doing a great job, I must tell you. I'll give her another couple of minutes. No, so here's the problem. You know, this is even, the problem is when you try to lose weight, it's really like you're pulling on this rubber band. Your body weight wants to be here. I don't know how she got here. We don't have time to figure that out. But it doesn't matter because this is where your body wants to be. And to lose the weight is one thing, but then to keep it off, you pretty much got to keep doing what she's doing right now. You got to keep pulling on this. And this is even true for bariatric surgery patients. Right? You go and you get your bariatric surgery, whatever, you lose 100 pounds, keep them off for I don't know how many, 10 years or whatever. If you went back to your surgeon and say, hey, Dr. Surgeon, can you take out my band or my whatever, guess what happens? Boom, the weight's back. Right? She did a fantastic job. Just give her a big round of applause. You were great. And that's the problem, right? So when you think of, the challenge is never, how do I get this weight off? Right? A lot of people always ask this, you know what, doctor, tell me, how do I get the weight off? And I say, you know what, that's not the problem. Everybody's always saying, how much weight can I lose and how fast can I lose it? I say, you know what, both of those questions don't really matter. The only weight loss that actually matters is the weight that you can keep off. And I cannot tell you how much weight you can keep off. But I can't tell you how much weight you can lose. I can also not tell you how much weight you can keep off, because that is going to depend on your individual biology. And it's going to depend on what caused some of that weight gain in the first place. Right? And that's one of the biggest challenges in all of this, is that I've been doing this for what, 25 years now? I can tell you in this entire time I've not met a single person ever who was cured of their obesity. Not one person. I've met a lot of people who've lost weight and are keeping it off. And you look at them, it looks like maybe they never had a weight problem at all. You wouldn't know. They're not cured. Every single one of them, like every single person who's in that weight control registry, is working hard every single day to not put the weight back on. And you know the guys who are the most successful? We heard this from Jim this morning. The people who are most successful in keeping the weight off? The guys who turned that into their profession. But I lost all this weight, I'm keeping it up, now I'll become a personal trainer, I'll become a motivational speaker, maybe I'll start my TV show, I'll start my blog, I'll turn this into my job. Because that's almost what it takes. But this is not, keeping the weight off is not something you can do on the side and you still have a job and you still have kids and you still have all the other stuff to do, and now you're trying to do this. That's how hard it is. And the question is, why is it so hard? Well, we just saw this, right? See, I have no idea how Angela got to the weight that she was at over here. But it doesn't really matter. Because no matter how you got there, your body now thinks that that's the weight I need to be. And we're just starting to understand how that actually happens. So how many of you have heard of the set point? Let me hear a hum. Yeah, everybody's heard of the set point. So for a long time, the set point was something that, it was like a theory. We thought there was a set point, and you kind of see it, because when you do animal experiments, you can take, not just humans, you can do a lot of this stuff in mice and, animals. You put them on diets, they lose the weight, you give them free access to food, boom, the weight comes right back. Right? And it comes right back to the weight that it would have been, before they lost weight. It's like they never went on a diet. So how does the body know that? How does the body know what the weight is that you need to be at? And why does that shift? Because that's the question. What's the set point you're born with? Let's say you're born at 6 pounds. What's your set point? 6 pounds. Right? Then you gain some weight, now you're 8 pounds. What's your set point? 8 pounds. Right? Now you're 2 years old. I don't know, how heavy is a 2-year-old? 20 pounds. Okay, now you're 20 pounds. What's your set point? So what's happening with the set point? It's going up. It has to go up. Otherwise you'll be a 6-pound adult if that set point is not moving. It's got to move up. It's designed to move up. It was never designed to go down. Biology never had to figure out how do we get a set point to move down. Because you never have to move it down. You only have to move it up. And so the way the set point actually changes the setting on the dial, if you think of it like a thermostat, the way that setting actually happens, it turns out, is a one-way street. And I know this is the saddest part of my talk here. And we're starting to understand how that actually happens. Because as most of you will know, there's this little tiny part of your brain that regulates your body weight. We call those the centers that control appetite, they control your metabolism, they control hunger, your feeling of fullness. All of those things are controlled in this tiny little piece of your brain that's hidden sort of at the bottom end. If I looked through your nose, I'd be looking straight at it. That's not a pretty picture. But that's the hypothalamus. And what happened, and in this hypothalamus, there's a bunch of neurons, there's a bunch of nerves that are all talking to each other. And these nerves, they get input from all different organs in your body. There's inputs coming in from your stomach, there's inputs coming in from your liver, there's input coming in from your digestive system. There's all these signals that are coming in and signaling to that part of your brain. But there's also hormones that are secreted in your body that are also signaling to that part of the brain. So you get stressed out, you get high levels of cortisol, well, they talk to that part of the brain. You got high levels of leptin, talks to that part of the brain. You got your hunger hormone, talks to that part of the brain. So this is a tiny little part of the brain. And what we now know is that that process of resetting this actually involves a process called gliosis, which is a nice fancy term. But what it basically means is it's scarring. It's scar tissue. So there's a tiny little microinflammation. Inflammation is not always bad. A lot of people, they think, oh, inflammation, that's bad. No, actually, inflammation is, the body uses inflammation to do good things. Right? Part of why we have the ability to do inflammation is because that's how we heal. Every time you heal, there's an inflammation, things get repaired. Right? That's how your body responds. So inflammation is not a bad thing. And the body uses inflammation for a lot of different things. And one of the things it uses inflammation for, apparently, is to reset the set point. And in animal studies, we're now starting to understand this. And we're starting to actually see that if you look at the density of connections that are actually happening at that set point, they change. Right? And they adapt to that higher body weight. And because the process that is used for doing that is basically scar tissue, it's not something you can undo. Right? Scars is a one-way street. It was never designed to be undone. That was never the problem. And in fact, there's a lot of species, there's a lot of animal species where the animal keeps growing throughout their life. But if you look at a herd of elephants, who's the biggest elephant? Well, the oldest. Right? Same is true for alligators. Same is true for a lot of different species, where the older you get, the bigger you get. Right? So that set point keeps going up, but actually never comes down. So that's the problem that you're up against. And until we figure out either how to stop the set point from resetting, and we're not sure we know how to do that, or we invent some kind of, I don't know, microsurgery to undo the scarring that's going on over there, we don't know how to reset that. Now, a lot of people think, oh, you know what, but I can reset it. If I lose weight slowly, maybe it'll reset. Maybe if I do this with a certain type of diet, maybe it'll reset. Maybe if I wait long enough, it'll reset. It doesn't. It's always there. It'll always want to get you back there. And that's what you're up against. And so when we talk about the whole concept of obesity as a disease, what we're actually talking about, no, this is not just a disease, it's a chronic disease. It's a lifelong disease. Like I said, I've never met anybody whose obesity has been cured. Now, you can get bariatric surgery. That's not a cure. That's a treatment. You can never go back to your bariatric surgeon and get the surgery undone. You get a band put in, you've lost the weight, guess what happens when you take the band out? Boom, the weight's back. Right? This is a lifelong condition. Now, that is depressing. Right? It totally pulls you down. But you know what? There are a lot of conditions that are lifelong conditions. Diabetes. A lot of people, when they get diabetes, look at someone living with type 1 diabetes. That's a lifelong condition. Right? You're a little kid, you get diagnosed with what does that mean for you as a kid who's got type 1 diabetes? Well, you're going to be injecting insulin for the rest of your life. And you're going to have to live with that. Now, can people live with that? Of course they can. We've got people who have type 1 diabetes who, live a healthy life, don't get the complications, but they have to continue treatment pretty much throughout life. Think of people with high blood pressure. That's a chronic condition. Most people who start off on blood pressure meds, they're pretty much on those meds for a long time. A lot of them will be taking them for life. We constantly deal with conditions for which we don't actually have a cure, but we've got good ways to manage them. The problem in obesity is not only is it a chronic disease, but we also have crappy treatments. And that's a real problem. If you think diabetes, how many pills do you think are out there for treating diabetes? Yeah, we're the pharmacists in the room. Come on. Why? There's probably 20 drugs out there. I mean, there's 40 different types of insulin that you can use to treat diabetes. How many pills are out there to treat blood pressure? What do you think? If you went to a pharmacy and said, tell the pharmacist, okay, show me all your pills that you're selling here, all the prescription medications that will help me lower my blood pressure. What do you think? How many pills do you think he can get out of 60 or 70? How many antidepressants are there out in the market? Hundreds, right? So for all of these other conditions, we've got all these medications out there. A lot of them have to be used for life because you're dealing with conditions that we can't cure, right? What we got for obesity? Well, now we got 2 or 3, and that's just now. Like until 2 years ago, there was nothing. I mean, there was one or two drugs in the market, right? And short term, right? So in obesity, we've got this condition that we're dealing with a chronic condition for which we don't have a cure, which affects I don't know how many million people, causes all of these health problems, has all these impacts on your quality of life, and we don't have treatments. We got crappy treatments. If I put diet and exercise as a treatment for obesity into a pill, the FDA would not allow me to sell that pill because it's so ineffective. Right? I would not be able to sell that pill. They'll say, you know what, come back with a pill that actually works. Right? And that is not to say that diet and exercise is not effective or is not useful. It is useful. It's very useful. If you improve your diet and eat better, you're going to get healthier. If you get more physically active, you're going to get healthier. You're going to feel better. It's great for your cardiorespiratory fitness. It reduces your risk for cancer. It does a million things. It's good for you. But what are the chances that you lose 100 pounds and keep them off? For the treatment of obesity, diet and exercise is not great. And yet we heard from Bill this morning that the people who exercise do a much better job of keeping the weight off. Right? Did you hear that? How many of you guys who've kept the weight off are exercising regularly? Or you stopped humming? Now we know. So, are you finding that the exercise is helping you keep the weight off or not? Why do you think that is? Well, I can tell you. Pardon me? Well, you're not eating. Well, you know what? Some people eat on the run, right? I mean, here I'm running and I'm. That's marathon runners, right? You're running and they're eating while they're running, right? That's like you're fueling your car while you're driving. But what happens when you exercise? You boost your metabolism a little bit. See, here's the thing about calories. How many calories do you think you guys are burning sitting right there? How many calories per minute are you burning right now? 10, 15, 5, what we got? 2, 1. Okay, what's the correct answer? Well, it's different for everybody, but it's about 1 calorie per minute. Depressing. But you guys are sitting there, my talk is 45 minutes, you'll have burned 45 calories by the end of my talk. And even if you're asleep, right? This is resting metabolic rate. Okay, so 1 calorie per minute. Now, of course, you can exercise, you'll burn more calories. So what's the, if you go for a moderate, jog, let's say, how many calories do you think you'll be burning per minute? Well, it's a depressingly low number. It's about 2 or 3. Now, you can really actually, you can do more. You can do vigorous physical activity. Well, even if you're looking at an Olympic athlete, how many calories per minute do you think those guys can burn, even if it's only for a couple of minutes? Well, they're getting up to 10 and 12 calories a minute, right? But they're athletes, and they're competing. That's how hard it is to burn calories. How many calories can you eat in a minute? Right? So this idea that I can somehow compensate, for the calories that I'm eating by increasing my level of physical activity is complete nonsense. It's complete nonsense. And the studies actually show that. All of the studies that have ever been done on exercise as an intervention to lose weight all show that the average guy, if the only thing you're doing is exercising without changing your diet, what happens to your weight? it either stays the same or goes up. That's what happens to your weight. Why? Because what does exercise help you do? Oh, work up an appetite, right? I always tell patients, you know what, if you're working up an appetite, you need to cut back. That's a normal response. So if exercise is not helping you lose weight or keep the weight off because of the calories that you're burning, then why does it work? What is it about exercise that's so important? Someone said building muscle. Yeah, that's overestimated. How much is the muscle? If you take all of the muscle in your body, what percentage of your total calories per day does that muscle account for? Anybody know? Well, it's 10 to 15% of your total muscle mass, right? How much do you think you can increase your muscle mass, without taking steroids? Well, if you can increase it by 5%, 10% maybe, okay? A 10% increase to 15%, it's a joke. Right? Don't kid yourself. People who think that I can control my weight by increasing my muscle mass so that my muscle mass is going to burn all those calories so that I can keep eating they're kidding themselves. Right? There's no way in hell that you're going to build up that kind of muscle mass that's going to burn an extra 200 calories a day. Won't happen. And yet exercise works. So why does it work? It makes you want to eat better. Why would that happen? Why would you eat better when you start exercising?
Because you feel like you put all that energy into it and you don't want to ruin it by eating.
You don't want to ruin. You produce chemicals or hormones here? Yeah, see a hand over there? Pardon me? Decrease your stress levels. Might help you sleep better. Well, gives you more energy. Doesn't give you more calories, but it gives you more energy, right? Not really, but it makes you feel a lot better. What else? So you're sleeping better, you're eating better, your stress levels are going down. Your basal metabolic rate maybe a little bit, maybe 2%, okay? It's not dramatic, don't bank on that. But all these other things that we're talking about, what happens to your self-esteem? How do you feel about yourself after you've exercised? Yeah, you feel much better. Someone mentioned sleep. Why is sleep important? How many of you guys have ever done shift work? Well, it's hopeless. That's my first advice to any patient who comes in. He said, you know what, if you're doing shift work, get out of shift work. Right? This is going to be really hard if you're doing shifts. Why? Because we know this. You do animal studies. You take mice and sleep deprive them, which, by the way, you have to do during the day because that's when mice would sleep. You keep them awake during the day, they get fat. You don't have to do much to them at all. Just keep them awake. And the weight goes right up. Why is that? What's this connection between not getting enough sleep and weight gain? And we're just starting to understand this. I mean, this is one of the most exciting areas of research right now. Well, it affects your hormones. But which hormones are affected when you don't sleep? Well, stress, right? Because every little thing is so much more stressful when you're not rested. My resilience, my ability to cope with things is so much better when I'm actually rested. I mean, there's so much stuff that's so hard to cope with when I'm rested. Now try doing that with no sleep. Right? Your stress hormones are going through the roof. What's my reward tolerance where are my energy levels when I haven't slept? Right? They're down there somewhere. It's coffee. Right? How many of us are getting enough sleep? Well, we got one person here. Thanks for waking up and listening. So, I hope it's not too loud for you, is it? Okay. All right. So, a lot of us are not getting enough sleep. Right? I mean, we survive on coffee. Take away our coffee. I mean, how many of you would function with no coffee? Well, some of you would. Lucky you. Right? A lot of people would not function without coffee because we're chronically sleep deprived. And we're starting to learn about the sleep. And then some people, they actually sleep. I got a lot of patients, they say, you know what, it can't be the sleep. I get enough sleep. I'm in bed 10 hours a night, Yeah, maybe you're in bed and maybe you think you're sleeping, but maybe you're not actually sleeping. What do these patients have? Sleep apnea. You guys all know sleep apnea. How do you know you got sleep apnea? No, you wake up in the morning, you got bruises. You say, where did that come from? Ever seen that, you know? Yeah, I don't remember. Yeah, partner sleeping with earplugs or in the other room. Pretty sure sign of sleep apnea. So, yeah, so you think you're sleeping, but you're not actually sleeping. Right? Your body's not getting the rest that it actually needs. Now, a lot of that stuff gets better when you start exercising. But a lot of that stuff gets better when you start feeling better, when you're less stressed. What's one of the things that keeps you awake at night? Worry, stress, things going through your mind, right? If you're a regular exerciser, that gets better. So the bottom line is one of the key reasons why exercise works in weight management and why people who exercise do so much better job of managing their weight is because of all these benefits that exercise has. It's not about how many calories you burn. So when you want to know whether your exercise is working for you or not, the question you need to be asking is this exercise making me feel better? And is it helping me eat better? Because obesity is not a calorie out problem. Obesity is a calorie in problem. Everybody thinks it's a calorie out. Oh yeah, I asked my patient, what do you think you need to be doing to lose some weight? Oh, I need to move more. No, you don't. You know what? I need to get more active. No, hang on. I tell my patient, you know, if you can lift 300 pounds out of that chair carried across the room, you're an athlete. Well, that's not your problem. Who's the biggest loser on The Biggest Loser? Jillian Michaels, right? I mean, I'd like to see her in a 400-pound fat suit doing some of those exercises, and I will see who throws up first. Yeah. Your problem is not you don't get enough exercise. Your problem is you're getting too much exercise. You wake up in the morning, you got all this weight, and then you got to take it out of bed, and now you're carrying it around for the rest of the day, and then you're wondering, why am I always so exhausted? Well, anybody doing that amount of work is going to be exhausted. How do you fix the exhaustion? Well, not by doing more work. You're already doing enough. In our clinic, we actually have people who teach our patients to slow down. Energy conservation. You're already doing way too much. And please do not use the stairs. Never, ever. Because you can't even see them. You miss one of those stairs, you twist your ankle, you're done. That ankle is never recovering. Please do not use the stairs, okay? Please do not park your car at the end of the parking lot so that you have to walk all this way to the entrance of the grocery store. Why? Because by the time you get to the entrance, you're so worn out you'll never make it back to the produce section. No, I want you to park in the closest you can possibly get to the entrance of that store so that you can actually walk around the whole store and get the good stuff. We keep giving this wrong advice to our patients all the time, pushing them harder and harder and harder when what they actually need is to slow down, and think about what some of the issues are. And there's no easy way to do this. There is absolutely no easy way to do this. If you think about it, we've talked about eating. How long does it take your stomach to tell your brain that you've eaten, that you're full? How long does that take? 20 to 30 minutes, right? You can do a lot of damage in 20 minutes. Right? But what does that mean that it takes 20 minutes? How many meals a day? 3 meals? 20 minutes per meal, that's 60 minutes. 60 minutes of eating. Not while you're on your phone, not while you're driving your car, not while you're on the, yelling at the kids, not while you're, doing other stuff. No. When you eat, you eat. And you're going to need 60 minutes to do that. And that does not include the time that it takes to actually make the food and clean up the mess. So if you want to do healthy eating, it's going to cost you 60 to 90 minutes. There's no quick way of doing this unless you want to go with some shakes or something. You got to chew your food. We don't even do that. Hamburgers, they come pre-chewed. Right? So you can just, bite and swallow. That's it. We're done. So if you think about it, this is going to take time. If you want to eat healthy, and you want to be mindful, and you want to enjoy the food, and you want to give you've got enough time to tell the brain that you've actually eaten. You're going to have to eat for 60 minutes a day. How many of you can honestly say that you spend 60 minutes a day eating? I'm not hearing a lot of hums here. You guys are all eating fast food, or you're eating too fast. Well, you're definitely eating too fast. Right? And part of the reason why you end up eating too much is because you're eating too fast. And you're letting yourself get hungry. Because what's the worst time to eat? When you're hungry. Never eat when you're hungry. No, you get hungry, you're done. This is it. That's it. You missed your opportunity to eat. It's over. Worst time to eat. Why? Because you're not going to make healthy choices. It's virtually impossible. Nobody ever says, you know what, I'm starving, where's the next broccoli hut? Nobody does that. Right? So you're going to make poor choices, and you're going to eat too fast, which means by the time the brain actually recognizes that there's some calories coming in, you've already shot past the mark. That's the problem with fast food. The problem with fast food is not the food. The problem with fast food is the fast. This morning we talked about grabbing a bite. We live in a culture of grabbing bites on the go. That's part of the problem. And if that's the way you're going to eat, you're going to have a problem. And that's just the eating. How much physical activity do you need to feel relaxed, to feel better about yourself, to get more energy? What are we talking? It's going to be an hour by the time, even if it's just 20 or 30 minutes of exercise, by the time you've changed and showered and all of that, it's pretty much an hour. Right, so now you were talking about 1.5 hours of healthy eating, on top of which you're going to do 1 hour of physical activity on top of that. And when people start physical activity, where do they always take the time from? Lunch. Yeah, some guys from lunch. Most people, I'm going to start exercise. I'm going to start running in the morning. What's my plan? Well, I'll get up an hour earlier, right? Which only works if I go to bed an hour earlier. Because otherwise, I'm cutting into my sleep. Right? A lot of people will take the time from their sleep. Well, that's not a good idea. Because you're going to need those 8 or 9 hours of sleep. So now you're talking 1.5 hours of healthy eating, 1 hour of exercise, 7 to 9 hours of sleep. Well, that's half the day gone. And that's just trying to be healthy. You haven't looked after the kids. You haven't done your job yet. You haven't done anything. So lack of time is one of the key reasons why a lot of people put the weight back on, because they say, I start all these things, and I know that they are all going to take time. And when I start, I'm going to make time for all of this, because it's new and I'm motivated. And then you run out of time. Time is your biggest barrier in all of this. And in our clinic, we actually run time management courses. I said, before you even start thinking about having a food diary, I want you to have a time diary. I want to know, where do those 24 hours go? And where in those 24 hours are you going to carve out the 2 hours that you're going to need every day for yourself to do all the things that I'm going to tell you to do? Because if you don't have those 2 hours, well then, I don't want to waste your time. Because this is hard work. Remember the guys on the weight control registry. These guys are turning this into a profession. Right? We heard it. They're giving up their jobs to keep their weight off. This is not easy. And why is it not easy? Because you're fighting your own biology. Your body does not want to be thin. Your body wants to be up here. And that's the battle you're up against, and you're going to be up against that battle pretty much for the rest of your life. And right now we've got crappy treatments. And I'm not saying that bariatric surgery is crap. It's great. It's good to have it, but I'm not a surgeon. And we can't do surgery on 60 million people. Right? So it's great if you can get it. If it works for you, fantastic, but this is not going to be a solution to the problem. And diet and exercise, we've been doing it for 100 years. That's not a great treatment either. So what we lack are effective treatments. And part of the reason we don't have effective treatments is because everybody thinks this is so easy. If these fat guys would just start moving and eating better, we wouldn't have the problem. Right? The last thing we want to do is now we'll give them pills to make it easy. when really they should be doing the work. I mean, that's the attitude, and that attitude is so pervasive and it's all over the place. I'm not going to pay for your weight loss drugs. Why? Because that's lifestyle medication. Well, you know what? My diabetes medications are also lifestyle medication. Actually, in fact, I get into a car accident. Sorry, that was your lifestyle. You know, we don't do trauma surgery on people who, you know, get into lifestyle accidents. Right? So that comes back to the whole weight bias and discrimination thing. But a lot of people don't understand this. And that's what I love about the OAC and about the fact that you guys come here, that weight bias and discrimination is so high on the agenda. We need to get people to understand the problem that you're up against. This is not easy. This is a lifelong problem. We need better treatments. But we'll never get those treatments if we don't invest the research dollars. If we think we can solve this problem with diet and exercise and motivational speaking, well, then we are kidding ourselves. So on that note, I think I got 2 minutes. I'll take questions. Anybody got an urgent question for me? There we go.
Is it true that as you gain weight, your fat cells can divide and you end up with more fat cells and you can never go back?
Yeah, you can continue growing. A lot of people, you might have heard this. That, you know, some people say, oh, you know, I'm born with the fat cells and then that's it. No, it's not. You're constantly making new fat cells and you're losing some of the old ones, and there's a turnover of fat cells, right? But some people find it very easy to make a lot of fat cells and some people don't. And if you were at my talk this morning, I was talking about large fat cells, small fat cells. The guys with the small fat cells, they can make a lot of fat cells. The guys with the big fat cells, part of why they have big fat cells is because they're not making a lot of fat cells, right? So there's differences, but yes, we can continue making fat cells, and yes, you can lose those fat cells, but the brain doesn't care. The brain is still interested in keeping you at 400. Question? Why is it going up? You know what, that's the million-dollar question. I don't know. Seriously, I have no idea. Because a lot of the things that you're looking at, which we think are the explanation, are not really the explanation. Let's take pop consumption, okay? Well, there was just a study in Ontario where they looked at pop consumption among high school kids. Guess who's drinking all the pop? It's the skinny teenage boys. But they got the highest consumption. What's with the fat kids? No, they're all on Diet Coke, right? It's always the opposite of what you think it is, right? So what's happening? I don't know what's causing this. Lots of things. I mean, I got colleagues that they think it's environmental toxins. You know, we got all these toxins floating around, and they mess with your receptors and change your cells and stuff. And it's not just the toxins in your food. Personal hygiene products. Shampoo. Yeah, read the label. It adds body. Right? You got to read this stuff. Watch out for it. Right now we're talking about the gut bugs. You guys know the gut bug story? Yeah. Okay, this is my last one. The gut bugs, right? Apparently all these bugs that live in your gut, they're causing the problem. So I got colleagues in Holland, and they've done the study. Like, they'll take the stool sample from the skinny guy, put it in a capsule, give it to the fat guy, right? The fecal transplant. Yeah. They told me about it. I said, what, you guys ran out of shit to study or what? Like, who does this? And it works. Metabolism changes. And now they're thinking about this, you know what? Maybe we need to turn this into some kind of weight loss product. I said, yeah, how are you going to sell this? You know, what's the ad going to say? You know, did you take your stool capsule this morning? You know, and whose stool are you going to use? You want vegan skinny stool? I can see a whole new line here for Gwyneth Paltrow. Right? I mean, there's money in this. Yeah, I was talking about the fecal transplant to my colleagues in India. I was in New Delhi. I was saying, you know, you guys heard about the fecal transplant story? He said, yeah. He said, hey, Dr. Sharma, you should know this. We have been doing the fecal transplant for a long time in India. Please try your salad. On that note, thanks so much for coming out.